Welcome to today's presentation on diversity, equity, inclusion, and belonging at the Division of Mental Health and Addiction. Today's training will cover the following: a description of the division's organizational structure, including a review of the division's mission, vision, and guiding principles, a discussion of how diversity, equity, and inclusion fit within the organizational structure of the division, common language and definitions in the diversity, equity, and inclusion space, and a consideration for how this information applies in real interactions. Let's start with our training objectives. This training was developed for new employees within the Indiana State Psychiatric Hospital Network. The goal is to ensure that employees within the hospital network can work well together through embracing diverse experiences, as well as to provide services that are culturally informed and sensitive at minimum, and culturally and linguistically competent at best. As a result of this training, you should be able to better understand DMHA core values as it relates to diversity, equity, and inclusion, define key terms pertaining to diversity, equity, and inclusion, and demonstrate a culturally and linguistically competent response in colleague and patient interactions. Let's take a look at the organizational structure of the Division of Mental Health and Addiction. The Division of Mental Health and Addiction, known also as DMHA, is one of 8 divisions of the Family and Social Services Administration, commonly known as FSSA. The Indiana State Psychiatric Hospital Network operates under DMHA. With nearly 2,000 employees, state hospitals employ nearly half of all FSSA employees. And as a significant arm of DMHA, the state hospital team is integral in achieving our mission and goals. The Indiana State Psychiatric Hospital Network includes 6 state hospitals, which include Evansville Psychiatric Children's Center, Evansville State Hospital, Logansport State Hospital, the Neurodiagnostic Institute, or NDI, Madison State Hospital, and Richmond State Hospital. DMHA's other primary areas of focus include mental health and wellness, addiction or substance use disorder, prevention, suicide prevention, and crisis response, equity and systemic integration, operations, data strategy, and recovery support services. DMHA's vision is an unyielding focus on promoting and supporting the mental health and wellness of the people of Indiana. The mission of DMHA is to champion mental health promotion and substance use disorder prevention, treatment, and recovery systems that are high quality, seamlessly integrated, and accessible to the people and communities of Indiana. Notice that high quality systems are defined as person-centered, innovative, data-driven, evidence-based, peer-driven, trauma-informed, and culturally competent. Cultural competence directly impacts service quality, as your ability to navigate cultural differences and respond appropriately can result in positive experiences for the individuals you serve. At DMHA, health equity and cultural and linguistic competency are integral to our values. Our health equity vision is that people of all cultures, races, and ethnicities will partner with local and state systems to achieve equity and access, services, interventions, and outcomes in our systems. Therefore, we will facilitate cultural and linguistic competency strategies throughout Indiana state and local systems to improve outcomes for populations vulnerable to disparities and disproportionalities. As a staff member of DMHA, it is our hope that you embrace our mission and our expectation that you serve our patients with our core values at the forefront. Let's talk about some key terms that are important to the discussion of diversity, equity, and inclusion. Diversity refers to the different characteristics that make up an individual or a group's identity. This refers to differences in race, ethnicity, gender identity, sexual orientation, age, religion, national origin, socioeconomic background, language, and physical ability. Acknowledging diversity means that we recognize there are individuals with cultures, experiences, and worldviews that are different from our own. When we take it a step further to embrace diversity, we demonstrate the ability to work with different individuals with respect and care. Equity refers to the process of identifying and removing the barriers that create disparities in access. One way to best understand equity is by thinking about an individual's access to a resource. Whereas equality means that every person gets the same resource as is depicted in the picture, equity would mean that every person gets the resource that they need based on their individual circumstance. Equity recognizes diversity in people and experiences and aims to create fair access, opportunity, or advancement that takes into account those differences. In essence, equity is about creating a fair playing field. Applying the concept of equity in healthcare refers to health equity. Health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health, and this includes behavioral health. There are multiple factors that impact health equity, including the environment and systems in which people exist. Achieving health equity recognizes ongoing societal efforts to address historical and current injustices, to overcome economic, social, and other obstacles to health and health care, and to eliminate preventable health disparities. Inclusion is ensuring that another individual can be the full and best version of their self while feeling valued and respected. The importance of inclusion can be linked to a theory called Maslow's hierarchy of need. The Maslow's hierarchy of need theory is based on the idea that humans have certain needs and cannot reach their full potential until more basic needs are met. One of the core human needs is love and belonging, which is achieved through relationships and a sense of connection. Inclusion promotes the feeling of belonging. Achieving this feeling creates the potential for an individual to be the best version of their self. It is important that DMHA staff experience belonging, a feeling of community or connection within DMHA or the individuals with whom you work. One way that people feel belonging at work is by joining employee resource groups, or ERGs. ERGs are voluntary, employee-led groups focused on creating community while in the work environment. Some of the benefits of getting involved with an ERG are that you can develop leadership skills in the workplace. You can gain opportunities to meet and network with others. You can gain knowledge of the resources across the agency, across the state and nationally. You would be able to engage with other agency staff outside of your typical team. And you would be able to enjoy these benefits with very little effect on working hours, as ERGs only meet for about 1 hour per month. We have discussed terms such as diversity, equality, equity, inclusion, and belonging. Now let's take a moment to tie all of these concepts together. This graphic explains the concepts using an analogy of going to a dance party. If we imagine there's a dance party we've all been invited to, equality would mean that everyone got invited to the party. Everyone is treated the same and they get the same invitation. Diversity is present in the differences across the party. That is, the party guests are from various backgrounds, identities, and life experiences. Equity is ensuring that everyone has adequate transportation to getting to the party, regardless of their starting location. This represents access. Inclusion is being a part of planning the party and being asked to dance during the party. Belonging is feeling comfortable to suggest party decor or to request that the DJ play your favorite song, and then enjoying the decor and music along with everyone else at the party. From this analogy, we can better understand how pursuing equality only or diversity alone falls short of ensuring fair access and true feelings of community and connectedness. Now that we have a better understanding of some of the common language, let's apply the language to the work that you will be doing. You may hear the term BIPOC, which is an acronym for Black, Indigenous, and People of Color, and is often used to highlight groups with ethnic identities that are not a part of the majority group. BIPOC is used when discussing the experiences of communities of color in recognition that these communities have collectively been impacted by systemic racism. Black or African American refers to those of African ancestry who are American. Asian American refers to people of Asian ancestry from the United States. Pacific Islander refers to people from Hawaii, Guam, Samoa, or other Pacific islands. Indigenous people or indigenous nations are the original occupants of a land or region who have been historically displaced. Hispanic and Latino, Latina, or Latinx individuals are people from Spanish-speaking countries who speak Spanish or people with heritage from Latin America. We also use terminology such as people of color or communities of color when referencing BIPOC individuals. Here is a breakdown of state hospital patients by race. 64% of state hospital patients are white, and approximately 34% are BIPOC, with 31% identifying as Black or African American, 2% identifying as Asian or Pacific Islander, 1% identifying as having multiple races, and less than 1% identifying as Native Hawaiian or Pacific Islander. 2% selected other. The state hospital patient characteristics are not exactly representative of Indiana's population, with some BIPOC identities being overrepresented in state hospitals. This means that you might encounter diversity in your work setting that differs from the diversity you experience in your own community. Now let's move on to state hospital patient sex. 74% of state hospital patients are male and 26% are female. This means that 3 in every 4 hospital patients are male. This demographic differs significantly from the state's overall population, where roughly 49% of Hoosiers are male and 51% are female. The average age of a state hospital patient is 46 years. The median age is 41. Comparatively, the median age of the Indiana population is 37.4 years of age. Patient sex is reported for the state hospital patients. However, it is important to note that patients may have a gender identity that does not align with their reported sex. Sex refers to whether someone is characterized as male or female based on biological characteristics and is usually assigned at birth. Gender identity is self-assigned and may not align with society's expectations. Gender expression refers to how an individual presents outwardly to the world. Accordingly, it is both respectful and inclusive to consider an individual's gender identity and expression and refer to and treat them how they prefer. Sexual orientation is also different than gender identity. Sexual orientation refers to a person's physical, romantic, or emotional attachment to another person and includes identities such as lesbian, gay, bisexual, or straight. For patient religion, 46% of the state's hospital patients identify with a Christian or non-Christian faith, while 34% are unaffiliated. The remaining 20% have an unknown affiliation. Considering whether patients have unique needs based on their religious affiliation and accommodating those needs will create a more inclusive environment. A person's religion will inform many aspects of their life, including their healthcare decisions. This includes their medication, dietary needs, adherence to treatment protocols, and other aspects of their healthcare. Religious connection can also have a positive impact on a person's well-being. As healthcare professionals embrace religious diversity, there is also a noted positive impact on health equity. There's improved communication and interaction between patients and providers, decreased provider bias towards patients, and increased patient satisfaction. We have considered various aspects of a person's identity and considered how these identity characteristics should be considered within a healthcare setting. However, Identity categories do not exist in isolation of each other. Intersectionality accounts for the overlap of identity categories such as race, gender, sexual orientation, and religion. Diverse social identities result in unique experiences across individuals. As we consider what it means to work with diverse individuals with identity characteristics that might be different from our own, we enter into the realm of cultural and linguistic competence. This is defined as the ability of healthcare providers and healthcare organizations to understand and respond effectively to the cultural and linguistic needs brought by the patient to the health encounter. Cultural competence requires you to value diversity, assess yourself, manage the dynamics of differences, and adapt to diverse individuals and communities. This includes attending to the language and communication needs of others. For instance, you may encounter individuals who do not speak English as their primary language. When engaging individuals with limited English proficiencies, speak clearly and slowly. Note that this does not mean that you need to speak loudly. Keep your explanations simple in order to give them time to process what you are explaining. Avoid using acronyms or common idioms such as, "we can kill two birds with one stone." Make eye contact to show respect and increase patient comfort. If you're working with an interpreter, stay engaged with the interpreter while also retaining eye contact with the patient. Attend to the patient's body language and facial expressions. It may signal the need for you to repeat something. And most importantly, be patient, as language barriers can be very difficult to navigate. Cultural and linguistic competence does not stop with navigating language differences, but mastering cross-cultural communication as well. Cross-cultural communication refers to the ways that people from different cultural backgrounds adjust to improve communication with one another. This includes the attempts we make to navigate cultural differences via language, gestures, and body language.
Our world today is more connected than ever. Several various communication platforms have sprouted, enabling people to interact with each other more often and allowing them to build new connections with people all over the world. So first off, what is cross-cultural communication? Cross-cultural communication, sometimes referred to as intercultural communication, takes place when at least two persons of two different cultures interact and communicate with each other. Today, as globalization and diversity in workplaces and various social environments become more rampant, it is unavoidable for cultures to meet, blend, and clash. Therefore, here are some useful tips for successful cross-cultural communication. Tip number 1. Always maintain etiquette. Wherever we go and whatever environment we are in, it is important for us to act and behave in the best possible way. Many cultures have specific etiquette with regards to the way they communicate. In fact, many cultures observe a degree of formality when addressing someone, such as the use of san in Japan and reversing family names and first names in China and Korea. Tip number 2. Show cultural empathy. Cultural empathy is defined as the ability to understand and be made aware of the cultural attributes of a given society and how they differ from their own culture. If you know you'll be interacting with people of different cultural backgrounds, it's best to do basic research on their cultures in order to avoid anything they might perceive as inappropriate or offensive. Tip 3. Speak clearly and simply. It is important to know that although many people have sufficient English skills, they may still have a hard time understanding someone speaking in a fast pace. In order for them to understand you, it's best to speak in a clear voice and a moderate pace, using simple words. Tip number 4, be conscious of nonverbal gestures. Nonverbal communication is just as important as verbal communication. One must observe their nonverbal gestures at all times, since some gestures may have a different meaning to people with a different cultural background. Do some research to know which gestures are inappropriate or offensive to people or situations you may be in. Tip number 5, practice active listening. Communication is a process that involves listening too. To prevent miscommunication, it's best to take turns when talking to each other and to avoid confusion, interruption, and other distractions. If anything in the conversation is unclear, just repeat what you said or ask to clear out any misunderstandings. Effective cross-cultural communication is about everyone feeling comfortable. It's also important to be understanding and respectful towards one's culture, especially when it comes to values, traditions, and religion. Utilizing and practicing these tips will certainly help you communicate more effectively across cultures and nations.
Hi.
Now, a final word on a concept called cultural humility. Cultural humility is having an awareness of the social power imbalances that exist, recognizing that not all groups have the same experience. Cultural humility requires a respect for other people's values and beliefs while continually evaluating one's own.
Cultural competency and cultural humility. You may have heard these terms before, possibly in the context of healthcare settings, and not quite understood what they meant. Let's go over what these terms mean and how they apply to everyday life. To be culturally competent is to learn about other cultures, control your biases, and adapt your behaviors and communication style considering the background of people around you. The goal of cultural competency is effective and informed interaction across various cultures. At face value, cultural competency sounds ideal, but it may actually lead us to rely on generalizations about certain groups rather than recognizing the uniqueness of each individual. We also have to ask ourselves, is it realistic or even possible for people to learn everything about other cultures and become completely bias-free? That's where cultural humility comes in. To be culturally humble is to be aware of social power imbalances, respect other people's values and beliefs, and continuously reflect on your own biases. With cultural humility, there's no expectation that you memorize everything there is to know about other groups. Instead, it's a lifelong process of asking yourself how your own biases might impact the way you treat and understand others, alongside work to minimize that impact. Cultural competency is a goal, while cultural humility is a mindset. Let's go over a few ways to practice cultural humility in our daily lives. Recognize that no culture is superior to another. Become comfortable with reflecting on and acknowledging mistakes you've made. Be honest when you're not sure about something. Learn about other cultures with the awareness that you'll never reach perfect understanding. Ask the people in your life if you can have open discussions and hold each other accountable during your learning journey. The great thing about cultural humility is that it acknowledges that no one can get it right all the time. In fact, a key component of cultural humility is being open about what we haven't learned yet. Although it can feel really uncomfortable to admit when we're wrong or don't know something, that vulnerability leaves room for us to continuously learn, grow, and promote equity and inclusion in our communities.
Let's review. DMHA's mission and values includes adherence to cultural and linguistic competency and health equity. Diversity, equity, inclusion, and belonging are common terms used to improve workplace experiences and interactions. Working at state hospitals will mean exposure to individuals with different racial backgrounds, gender identities, and religious beliefs. Understanding cross-cultural communication will result in more successful interactions. Approaching your work with cultural humility means respecting others' beliefs and constantly reflecting on your own values. Visit the DMHA Cultural and Linguistic Resource Center for additional resources. You can also visit the Hub for agency and division updates, information, and resources, including how to join one of FSSA's employee resource groups. Thank you, and welcome to the DMHA team.